Technology is developed first and evaluated later for hopefully equity. But equity, I don't think, is a feature that is added until afterwards, until someone complains or until someone says, this is not really helping or working with me. And so I think as a qualitative researcher, I've learned that people who experience these inequities every day are the best or are the experts in those encounters. And so just really understanding we have to do a much better job and work better at designing with these communities in mind, or we will start to replicate a lot of the structural issues that we have, but it'll be much prettier.
Welcome to Partners for Advancing Health Equity, a podcast bringing together people working on the forefront of addressing issues of health justice. Here, we create a space for in-depth conversations about what it will take to create the conditions that allow all people to live their healthiest life possible.
Hello, and welcome to the Partners for Advancing Health Equity podcast. I'm your host, Caryn Bell, Associate Director for Partners for Advancing Health Equity and Assistant Professor at the Celia Weatherhead School of Public Health and Tropical Medicine at Tulane University. I'm excited to have 3 guests with us here today, all of whom are grantees of the Robert Wood Johnson Foundation's Health Equity Scholars for Action program. First, we have Dr. Celia Lewis, Assistant Professor at the University of Missouri College of Health Sciences. Her work focuses on racial mental health equity. She holds a Master's of Science and a PhD in Public Health from the University of South Carolina, where she specialized in health promotion, education, and behavior. As a researcher, she examines how racism and other systems of power shape the mental health of Black young adults, especially their experiences with stress, depression, and seeking care. Her work blends social science, community perspectives, and mixed research methods to understand how discrimination affects daily life and long-term well-being. Dr. Lewis designs interventions that aim to reduce racial gaps in mental health care and improve access to supportive services. One of her current projects explores how structural racism and limited access to mental health services influence suicidal thoughts among Black emergent adults. She brings deep expertise in racial, mental health equity, and social determinants of health to conversations about technology and justice. Welcome, Dr. Lewis.
Hi, everyone, and I'm grateful to share this space with you all.
We're grateful that you're here. Next, we have Dr. Rochelle Davidson Monde, Assistant Professor at George Mason University. With a Doctor of Philosophy and Communication from George Mason, she is an applied health communication scholar whose work focuses on reducing health inequities rooted in racism. She develops digital, family-based, and community-driven interventions that support sexual health, trauma recovery, maternal health, and HIV prevention. Her research uses mixed methods and community partnerships to ensure that families' experiences guide the design of tools that improve health communication. Dr. Davidson Monde's background includes project management and communication strategy in roles in South Africa and other global South settings. This gives her a global perspective on structural injustice and community resilience. One of her current projects pilots a digital tool to help Black parents talk with their children about sexual health and trauma, improving health literacy, and improving confidence. She offers expertise in digital health interventions, anti-racism in health communication, and community-centered design. Welcome, Dr. Davidson Monde.
Thank you so much for having me.
Thank you for being here. And last but certainly not least, we have Dr. Henry Willis, a clinical psychologist and assistant professor at the University of Maryland College Park in their Department of Psychology. He earned his PhD from the University of North Carolina at Chapel Hill and completed advanced clinical and research training at Columbia University, the University of Pennsylvania, and Montefiore Hospital, Albert Einstein College of Medicine. His research examines how online and offline racial discrimination affects the mental health of African Americans and how cultural strengths such as racial identity can protect against depression, anxiety, and trauma. Dr. Willis also develops culturally adapted treatments and uses mobile health tools to expand access to care for underserved communities. He directs the Create Lab, where he mentors graduate students and leads projects that blend technology, racial equity, and mental health. In one of his current projects, he is collaborating with Black teens to co design a free mental health app. He brings deep insight into tech enabled mental health equity and racial discrimination research. Welcome, Dr. Willis.
Thank you. I'm excited for the conversation.
I'm excited too. So, I think I want to start with asking you all what drew you to the work that you do, especially thinking about the role of technology, how it changes so quickly, what really keeps you motivated in this work. I think we can start with Dr. Lewis.
Yeah. So thinking about or rewinding time to go back to my doctoral program, just thinking about the ways in which I was taught about public health, and particularly with the focus on Black American health. And it was more so always this population is experiencing X, Y, and Z as a way to say that the problem lies within them rather than really understanding the structural issues that our community faces. And so, in particular, when thinking about technology and just this kind of thought that we have that it is kind of separated from all of the ills of the world, just really focusing in and understanding that connection between the society we live in, technology, and how to better the health of Black Americans.
Okay, thank you for framing it that way. Actually, that makes me think of it differently too. Thanks so much. Dr. Davidson Monday, want to go ahead?
Sure. So I think what led me to this work is the advocacy work that I was doing in South Africa and realizing how much digital tools seemed more accessible than sort of clinical information. And so people would share information like on WhatsApp or phones. And so it was interesting to me how these spaces were becoming more places to share information about health and to support people. And I felt like they were underutilized by scholars that look like us and folks that are committed to equity and justice in our communities. And so I wanted to incorporate that into developing evidence-based interventions that really kind of go back to the root of what communities are already doing.
Yeah, thanks for that. I never thought of like the role of the group chat in advancing health equity. So yeah, thank you so much. Dr. Willis.
Yeah, there were two things that really motivated me to pursue this work. And one is from my professional experiences, especially when I was a student. So I was a research assistant in different clinics and in mental health clinics and in different hospitals. And I saw that despite these clinics and hospitals being around or nearby Black communities, Black folks weren't actually represented in those studies, that we say is, forms the evidence base for research and for treatments. And so I really thought about how technology can be a way to not only increase access to research and mental health resources to Black folks, but how it can be a way to start to bridge this gap between actually wanting mental health care and receiving mental health care. And the other is more personal in that I'm just a tech nerd and I've loved technology since I was little. I got my first computer when I was 6, and by the time I was 12, I was being called by all my aunties and uncles to come set up their computers and all of that good stuff. And what keeps me motivated, especially seeing how technology is evolving, is really just seeing just that bidirectional relationship between technology and people. So we know that tech is growing and accelerating very quickly, but also the ways that we're using tech is also growing. And the way that I've been seeing Black youth and Black communities in particular use tech in their own ways for good and for joy and healing has been really inspiring.
Wow, thanks. I think all of you all have sort of articulated this idea of tech being a tool to address the inequities that we're seeing in our society. But I think we all, kind of have this idea that technology should be neutral. But we know that, in both its design and implementation, it reflects our society's values, including society's biases and isms. Um, so where do you see technology reinforcing existing health inequities, and what concerns you most as digital tools become more common in healthcare? I think we can actually go in semi-reverse order and start with you, Dr. Willis.
Yeah, this is a really great question. So, one of the biggest concerns I have with technology is that for many researchers and many clinicians, we might look at technology as this silver bullet. Like, this is the new thing that can kind of help address all the health inequities that we see. It is the solution to all of our problems. But, like you said, technology isn't unbiased. And if we don't address those existing structural or social determinants of health that we already know contribute to health inequities, technology is just going to recreate that broken wheel, so to say. And so we know that all communities, especially Black communities, don't have equitable access to phones or computers or the internet. And most importantly, we know that our treatments, and I'll speak particularly for mental health treatments, they weren't designed for communities of color. And so that means if we just use technology to disseminate these treatments, then we're just disseminating something that probably already doesn't work, or probably isn't something that people want to pursue because of past harms caused by the medical system. So, one of the things that, I worry about is, how can we, how can we kind of keep that in the center of the conversation when we're thinking about technology to address health inequities? How can we remember that these interventions, they can't resolve experiences of racism related stress if we don't design them to do such? They can't, reduce stigma caused by medical mistrust and harms by the medical community. And so, really going forward, I often think about, how can we make sure that tech is being created and implemented, with those communities that are most underserved in the center, and just to hold ourselves accountable so that we don't assume that, tech by itself is the solution to addressing health inequities.
Thanks. Dr. Lewis, what do you think about that same question, the role of tech and how it can, exacerbate inequities?
So I think about that and the role of my research and just understanding help seeking behaviors. And so, like, technology again does not exist outside of our world. And so the same structural inequities that shape in person help seeking or in person utilization of mental health also shape how we think about tech. And so, again, even starting at like the baseline of fundamental kind of assumptions, we have all of this available. Why isn't this population using it? Rather than we have this available, how are the same inequities that may be present if I walk into an office the same thing that's present when I use certain types of technology? And so, again, really thinking about technology and how we are framing it from that level of just like understanding that even help seeking isn't simply about like these individuals' decisions. And so, again, how do we understand that kind of structural barriers and how it's built into something that we may think is innocuous and or think is kind of a solve all, but still we're ignoring just these lived experiences of the communities that they were supposedly built to serve.
Thank you. And Dr. Davidson Monday, how do you think about it?
So, from my perspective of the research I'm doing around sexual trauma, I really think about the challenges around tech when it comes to privacy and, this assumption that or the misassumptions are really just not knowing where is the information going, right? And so as much as like I think these tools can be useful, and I think especially depending on who's developing the tools, are they being developed with the people that are going to use them? Are those folks, you know, have the digital literacy to understand how to use them in a way that protects their safety and their information? It's as much as I would want to roll out things that could bring more access to survivors or people that are experiencing trauma, I'm also very cautious about how that's happening and who has the power to lead that process, and whether or not we're transparent with every part of it, right? And so there's a lot to think about, but ultimately, I'm considering things like privacy. I'm considering things like who gets to design and who has the power to design, and where information goes, how it's used. So that the same questions that we have around trust and mistrust in our communities, it's still there when you use digital tools. Those questions don't go away. They're just sort of reshaped, and we need to think about how to address it. But those issues remain, and in some ways, they're kind of exacerbated and amplified because I I engage with folks who use these spaces almost thinking that it's like their private journal, right? So they will talk about the situations that they're experiencing and say, how can I get help for this? I just experienced this, not knowing whether or not that information will be used to, to improve, they say improve the product, or we just don't know, right? There's a lot of unknown. And so I think it's really about, well, who is behind the design? How are we in the same room as those who have the power to develop these products? And then how can we keep them accountable to those that could be easily marginalized and harmed by them?
Yeah, I hadn't thought about how people could use that as like basically a journal, but the idea of privacy being an issue, the idea of mistrust being an issue, really what everyone has said makes me think about the idea of fundamental cause theory that, we can do these interventions, we can make these advancements in society, but if we don't address the fundamental cause of inequities, then, we're just going to be replicating and sometimes exacerbating the issue. But, one of the major fundamental causes of health inequities in our society is racism. So I'm going to ask Dr. Lewis about your work specifically that examines how structural racism shapes mental health and help seeking among Black young adults. How does the technology influence whether someone feels safe asking for help or decides not to?
Yes, it's a great question. And so, really thinking about that kind of connection between structural racism, my research also forms how attendant forms of like whiteness also impact help seeking behaviors and just mental health service utilization among Black emerging adults who live in Missouri. And so, for many emerging adults or just marginalized populations in the United States that do experience racism, discrimination, or just being misunderstood within these healthcare systems and educational institutions that shape their health across or until the day that they die. And so, really understanding or integrating how technology impacts that with the understanding that technology doesn't erase those experiences. In many ways, it can amplify them in a really negative way. And so, for example, taking what my colleagues have said and focusing on or understanding these digital mental health platforms, telehealth services, we've all seen them, heard them, symptoms checkers, AI-enabled tools that we all may have used, know of, and sometimes may suggest to family members, and just understanding that when we use them, it's not kind of this solve all. And so understanding the role that structural racism plays in that. For example, really thinking about my research and doing qualitative research and understanding that a lot of the participants really talk about bias in healthcare and talking about bias and structural racism in the ways that they face them on a daily basis and how that kind of served as a way to stop them from using in-person services. And it has become that reliance upon these AI tools. So, for example, ChatGPT and how they, again, thinking about what another colleague said of how they use it as a personal journal. And so, using this research to understand it's not necessarily that technology is bad, and even having to change my own thoughts about it. It's more so of if I want to serve and help, understanding who does it work for? How do we understand what conditions that not only the technology was made in, but how are participants using it and who is included in designing it. And so it's just all of this happening all at once to really understand that it's going to be a difficult, but not a journey that we can't really work towards and understanding and disentangling slowly but surely how we can not only name structural racism and those other forms of power, disentangle what it means, and also work to fight against it to really serve and use these tools that are not going away to really help amplify positive mental health.
Thank you. I think that you all are speaking the same language, which is great when researchers and potentially healthcare providers are saying that, hey, I want to use technology, I want to use this new thing. Hey, you might tell them you need to be thinking about mistrust, you need to be thinking about racial bias that still shows up. There are many things that you all have said, but what are some of the things that if you were advising a group of researchers or policymakers or healthcare providers, even the technology developers themselves, if you were advising them on what is missing in their work that actually addresses the lived experiences of the people that they are serving, what might be one or two of those things that you're like, hey, y'all are trying to do something good, awesome, but y'all need to make sure that you're addressing this, that. It can be anything that you're thinking of, but what are some things that are missing in the discourse? How about we start with you, Dr. Willis?
Yeah, well, just to follow up with what my amazing colleague Dr. Woods was saying was, one, these technology interventions or approaches, they have to be tailored and created to address racism in all of its forms. So structural racism, interpersonal forms of racism, and something that my research looks at a lot now is racism that exists in online spaces, whether it's on social media or coming across videos of Black people being shot by police. All of these experiences creates a form of trauma that can negatively impact the mental health of Black youth and Black communities. And so if our tech interventions aren't built to help people cope with these real experiences, then it's going to always miss the mark. And I think the second thing is to really center that strengths-based approach. So to think about what are the ways communities have already been resilient? What are some of the healing practices that already exist within families and communities of color? And how can we use technology to bolster some of those things that already exist, such as like Black joy or collective healing? And so really thinking about, oftentimes people kind of correlate technology use with being isolated in some way. So really thinking about how technology can actually be a way to kind of really bolster community and collective healing.
Thank you. We just did a podcast on Black joy, so I appreciate you pointing that out. Dr. Davidson Monde?
Yeah, I really agree with what everyone is saying. I'm thinking about though how, again, going back to this space of assuming that it's a private space and why people may be more inclined to want to use these language models, right? And so you think about stigmatized issues and why people don't want to disclose that they're dealing with something, whether it's mental health, HIV, infection, sexual trauma, these very highly stigmatized experiences, and why people don't talk about it, right? And so they might want to communicate, or we are seeing upsurge in using chatbots to communicate about stigmatized experiences. Why are they doing that, right? I'm really curious and interested in why they're doing that. And as I'm speaking to folks and participants, a lot of it is that they're the way that these models are developed, they're not developed to stigmatize you, right? They're kind of developed to agree with you and to somehow seem like they're supporting you, which can give I want to use the word false very carefully, not in a judgment sense, but it's not a real person, and they may not be quietly trained. They're not trained clinicians and or practitioners. So the danger is that will use these things to gain support and find a place of solace and be able to talk or communicate and get information. But what is missing, right? And so a big thing about what's missing, I think, who's developing this stuff, right? If we think about OpenAI, how many Black scholars, behavioral scientists, social scientists were in the room to ensure that their responses were considering how structural racism shows up in the lives of the person that's typing in the question in the chatbot, right? The Black youth who may not want to ask about mental illness because maybe it's stigmatized in their home or in their faith community. So they asked ChatGPT or they asked Gemini, I'm having these experiences. What should I do? Who's in the room to ensure that the responses from these these digital spaces are considering the complexities of a Black young person, right? And so we have to, as much as there are a lot of environmental and economic justice issues related to the expansion of AI use, the pragmatic response is we still need to be in the room. We still need to be the developers. We still need to be the ones that are consulting the designers, because if we're not, we are absolutely going to replicate structural injustice, particularly structural racism. And in fact, I think it will be even more harmful, because now it's going to the psyche of someone who's reading the response from OpenAI. So now it's like it's not a real conversation with another human being that can actually help you. And so there's a lot of there's a lot to consider about how people are interpreting the communication coming back from these spaces, and how it's starting to feel like it's an interpersonal relationship when it is not. But again, rather than sort of judging people for using it and demonizing the use of it, I think we really need to understand why people are doing that. And I think one part of it is that there is isolation, there is stigma. And so, yes, we want to deal with structural racism, but we also need to consider how many of the health issues we talk about are so highly stigmatized that it's actually where many folks are silenced. And yet these spaces seem to open up a space for communication, and we need to be very careful with what messages we're sending. So I guess, in short, what I'm saying is that people are using it, right? And actually marginalized folks who may not trust a clinician, who may not feel comfortable talking to an adult, who may not, right? All those folks are actually more inclined to go and use these spaces as a private space. But we know they're not private, and we know that they're not quite informed by the very folks that need to be behind informing the messages, right? So now what are we going to see, right? And we're seeing negative impacts of using large language models among Black youth, right? It's emerging data, but we're seeing it, right? We're seeing suicidal ideation coming up. We're seeing how they will go and talk about the traumatic experiences that they're having, but that does not necessarily signal help seeking, right? And so I just think that we can't afford to not be involved, right? Because people are using it, and we need to be where the people are, and we need to be part of what holds these spaces accountable. And more importantly, we need to be behind the design so that these designs are actually promoting the health and the well-being of those that are often not served or sort of marginalized by, clinical and medical spaces.
I honestly could talk about that topic all day. The communication with a non-human, to me, seems very dehumanizing. But if that is the small bit of humanity that you can grab, or particularly in the most painful situations or the most stigmatized, marginalized, oppressive situations, then yeah, we can understand that. But I think what you're saying, the next step is having researchers, policymakers, healthcare providers, people who design the technology, thinking in the way that you're talking is what is necessary. But then my question is, what is the driving force, right? As a researcher slash, I guess, a practitioner, provider, a care provider, your motivating force could be different than the motivating force of the tech designer. So I'm just wondering about like which driving force prevails, and always in our society, the driving force that prevails is capitalism. Right. So I just, like I said, I could talk about this literally all day, but yeah, these are the things that, I'm sure our listeners will have similar responses as well. And these are, thought-provoking conversations. And I just wonder what what's the rest of the conversation? And honestly, we're going to have to keep having the conversation because just like you said, the technology is not going anywhere. And people are using it. More than that, not the technology not going anywhere. It could, but people are using it. So I think we'll have to continue these conversations, but those will be my next questions. But I'm not being interviewed here. I'm interviewing you all. So Dr. Lewis, even whether you want to respond to what was previously just said or respond to the original question, which was, what do you think is missing for providers, for researchers, for tech designers in this space?
Yeah. And I definitely want to piggyback off of and use Dr. Davidson Monday's response to kind of think of two things. You can't design this for communities without designing with the communities. And even with designing with the communities, you have to really problematize what you mean when you say, for example, I have Black emerging adults at the table. Are they just sitting at the table and being quiet, or are they actually integrated into every little piece of what you're developing? And I think about that because we have a plethora of tools. And one of the things that really concerns me is that we or society may look at these tools as a one size fits all. I mean, it's there, you should use it. It works for everyone. And really understanding not to wait till the end of that design process, whether it be someone creating an intervention, whether it be a researcher or a practitioner, to ask, okay, so I've designed this. What do you think about it? Involve particularly those communities that you say you want to serve from the very beginning until the end. And I think when we kind of look at it that way, technology is developed first and evaluated later for hopefully equity. But equity, I don't think, is a feature that is added until afterwards, until someone complains or until someone says, this is not really helping or working with me. And so I think as a qualitative researcher, I've learned that people who experience these inequities every day are the best or are the experts in those encounters. And so just really understanding we have to do a much better job and work better at designing with these communities in mind, or we will start to replicate a lot of the structural issues that we have, but it'll be much prettier.
Yeah, I mean, I always say that, the solution is already in the community when people ask me about community engaged research. And I'm just like, we just need to move out the way or give up some resources, facilitate some relationships, some power shifts to make things happen, to allow for things to happen. And I think, Dr. Willis, you can talk about this specifically having solutions come from the community. So your work is with Black youth, and you are working with them to co-design a free mental health app. So I guess, could we just ask you specifically, what does co-design actually look like in practice?
Well, in practice, it looks very fun and messy, but in the most beautiful ways. It looks like having to hold to what feels like two opposing truths. Like you go in with a plan of how you hope things will turn out, and you also have to hold that truth that you have to be willing to rip up that plan at any moment. Because at the end of the day, the community knowledge, like you all were talking about, and community preferences have to take precedent over the quote unquote plan that we have going into a study or a co-design kind of effort. And I echo a lot of what Dr. Lewis just said. That it also means treating youth as experts in their own experience and their own preferences, and more importantly, treating them as colleagues. So some of our researchers like to treat community members as experts, but not necessarily as colleagues. And when we treat someone as a colleague, that involves what you were just saying, that power sharing, like giving agency, giving space, and giving freedom for the youth or whoever we're co-creating with to be creative, whether or not, it conflicts with the conventional way of doing research as we were taught. And, as a Black scholar, I also, really try to hold this central in my work, because when I am co-designing in a research study, I'm not just a detached observer. Like the youth see me, I could be an uncle, a cousin, an older brother. Might even be a mentor or a role model one day. And so the way I show up and the way I co-create and work alongside youth, really has a lot of implications outside of whatever we're creating in the moment. And I try to keep that centered in all of our research activities. And most importantly, it means that things aren't done until the community or the youth in this case find it acceptable or say that we're done. And it means including them at every stage of the development process. So in the app that we've been co-creating, the youth that I've worked with have helped us think about the features that belong in the app. And I don't know if you've been around any teens lately, but they're honest, brutally so. So they never have a problem sharing their opinions, and so we take all of the feedback and incorporate it. We've actually had them design actual screens. They give an input on the name, the look and feel of the app, and they have actually even participated in the early testing of the app, even the AI portion. So we've taught them how to do what we call red teaming or adversarial testing, where they're challenging the AI to make sure it doesn't do anything irresponsible or anything that can be, culturally toxic or irresponsive. And they find it fun, just like I find it fun. And currently, we're working with them to actually help us think about how they can implement what they've been designing in their own schools and communities. And so I just really want to kind of circle back to the main point. Is about power sharing and giving agency and space for those solutions that we already know exist in the community to kind of be able to emerge and flourish.
Yeah, thanks. I have been privileged to work just a little bit with Black youth here in New Orleans on mental health. I've been, obviously impressed by their brilliance, but also gagged by like some of the things they say, just the framing and the ideas. I'm just like, yeah, why right here? But it's really to learn and to facilitate, like you said. So I wanted to ask you, can you share an example of something the youth that you are working with that they wanted that surprised you or changed the project's direction?
Yeah, and I've had those same experiences with teas. There are so many times I have to catch myself and stop myself from laughing at things that they say. I was like, all right, I'm not supposed to laugh at that, but it is really funny. I am going to keep a note of it. But in terms of the question, so one of the biggest things is really AI support. So going into developing the app, I had no original intention about including AI for a lot of the dangers that Dr. Davis and Monday had already talked about. But I was surprised that the youth that I work with, are already, like Dr. Davis and Monday said, using it for all those reasons. And they want it in a mental health app, and they want it in technology that's developed for them. And so I think this just speaks to how Black youth themselves they're in the know, they're on top of these things, and they're already thinking about how they can transform these new technologies into solutions that can be helpful for them. And I think the second thing that, we learned that changed the kind of direction of the project or the app a little bit is integrating social media aspect. And so, I went in thinking that they would want more in-person connections, especially because this generation, they went through lockdown, like they were in middle school, but, during the pandemic, now they're in high school. And so, I really, and also given the research that we've seen about social media and negative mental health outcomes, I was really expecting them to not want as much social media, but actually they really wanted a social media space within the app. The key was they wanted it to be specific to them and something that's protected. And so I think it speaks to, not necessarily looking at social media, as a form of technology that can be dangerous, but really thinking about how like some social media channels, are no longer safe spaces, and Black youth are still looking for those digital safe spaces where they can talk to their peers and they can feel a sense of community, and especially around mental health topics. So those are two of the main things that I think were really surprising as we started doing this co-creating work.
That's interesting. It reminds me of conversations where people are talking about bringing back MySpace. I say, sometimes we should go backwards to go forwards. So yeah, thank you for sharing that and talking about, I think what, again, what all of you all are talking about brings up for me the need to do research based on people's like actual lived experiences, not just, what we read in a book or read in these journal articles or what even, assumptions the field might have about people. So I think Dr. Davidson Monday, I will want to ask you about your work, which helps Black parents talk with their children about sexual health, including difficult topics like sexual trauma. These are very personal, things. And so I want to ask, why did you decide to use digital tools and social media as a part of that work?
Yeah, thanks so much for that question. So for me, again, it was about, well, what's already happening, right? And so doing qualitative work as well, and kind of um, engaging with Black parents and Black youth, start out with youth really, and then youth saying that my parents don't talk about these things, right? And so then leading to talk to the parents, and the parents are saying, well, we don't know how to talk to youth, especially today, because social media is, we're we're old millennials or we're Gen Xers, right? So they're not digital natives like their children. And so there was a gap between parent and child that could be potentially supported by a digital mechanism or a space. But how do we do that, right? And so all of my work is also community engagement. So having both Black parents on in our co-design process and Black youth, it's social media was a big place that folks were like, this is where we are. This is where we're getting information. This is where I'm learning how to talk to someone I like. So not even like, open AI or like large language models, but just social media posts from other people, influencers, etc. So parents were saying that they have to compete, not with like your friend. Back in the day, it was like, oh, my child is learning about these topics with their friend. Now parents are saying, my child is learning about these topics through social media. So it was both one to build the efficacy of parents to say, this is where your children are already. Do you know how to engage here? Do you know what they're watching? Do you know which sites or which influences are big? And trying to build and sort of demystify the social media space for parents of Black youth. And that they were excited about that, to be honest. It was like, here's some ideas that we're thinking about. What do you all think? And so what we developed was like a digital it looks like a graphic novel, but it's very short, just 10 slides of a story and a narrative that has father and daughter and then mother and son. And it was different sex genders because my research and other folks would say that same gendered parents struggle or don't have a struggle, right, to talk to the same gender of their child, but the opposite was more of a struggle, particularly fathers and daughters, right? So because of that, we said, let's create narratives that support rather than just identify what the struggles are. These narratives are supposed to support the growth of parents and support the development of this type of communication. So from the design, from the narrative, from the way it was structured, everything was involved parents and youth, and saying, I would have preferred my dad to like knock on my door and be aware of what I'm seeing online and saying, hey, I saw this on TikTok. What did you guys think about this? Right. So even up to the point of how to open the conversation was based on these community engagement, same thing as Dr. Willis described. So we see it as a place where we can actually scale interventions and like see like, oh, there's more scope to this. We can build this out. But it's not supposed to be a substitute, right? And a big part of the intervention is, well, how do you take these conversations offline? Like after you realize how to talk to your child about what they're seeing on social media and what's sparking conversation, how do you sustain this communication and build this relationship offline? Because we know that that is still very critical to youth development and sexual behaviors, right? Parents' involvement with youth still is one of the biggest factors to delay sexual engagement and risky sexual behavior. So with that end in mind, right, to support the youth, support development through the parent, which oftentimes parents are not equipped. How do we use digital spaces to equip parents and to build that bridge? And that's kind of what we're testing right now. But it has been uh, well received in the communities that we work in the DMV. And we're just trying to see how we can do it in a way that is culturally responsive, transparent, private, secure. And those are all things that we're still kind of building out with developers.
I'm thinking about how we have identified some of the harms and some of the things that are missed by the tech industry. And you all eloquently described those things as well as, next steps in how to address them. But I'm wondering, what is your metric for success given these sometimes different goals, whether that be in the community, the families that you're working with, as opposed to, you could even think about like your grants and stuff that we have to go after these grants and be productive. How do you know that you are successful with the work that you are doing?
Let me start with the community first, where my work is for them. So what I ask parents what they want, right? And I ask youth what they want. And both parent and child's, and I'm looking at children between 10 to 19, they do want a safe place with their parents. Parents do want to feel like they can talk to their children about very difficult topics that their parents never spoke to them about. So for me, the success from that point of view is how to support relationships and support healthy communication that's factual, right? So it's reducing misinformation about things like sexual trauma, about mental health. So again, reducing stigma, reducing victim blaming beliefs. That's a big measure, right? Can we provide information to parents so that they are not communicating victim blaming beliefs to their children? For example, can we create interventions that reduce the amount of conversations about how a victim was dressed, which led to her trauma, right? Can we reduce the assumptions that a Black girl is just asking for attention or she's lying because she's fast, right? Can we really get down to the belief system? That's a very big, tall, right, order, but it is a benchmark for me. Now, for parents, that's one part of it. For them, they just want to be able to talk to their children, and they want their children to talk to them. But for me, as a trauma advocate and sexual assault advocate, I want victims to be believed, right? Can we use digital interventions to support victims' health and well-being, right? By reducing stigma, by reducing victim blaming beliefs, by promoting help seeking in a way that does not re-traumatize people. So those are kind of my benchmarks for success. In terms of, you know, funding and writing proposals for interventions beyond your pilot, they're looking at, statistical evidence that these associations are are happening, right? And so, yeah, I think the design, I actually think that the rigor of the design is based on the community involvement. So if the community is involved, we're going to see high statistical association for the relationships that we are trying to enhance. I believe that if the community is involved, if parents are involved, if youth are involved, we're actually going to see that parental efficacy is improved because they are the ones behind designing it. We're actually going to see victim blaming beliefs reduced because survivors are a part of developing the messages and the narrative. So for me, if it's really rooted and grounded in community, like co-design all the way down, like Dr. Lewis said, Dr. Lewis said, that we are really holding ourselves accountable every step of the way, from design to intervention to implementation, I believe that the money will come to support it. I'm hopeful, but I think money will come from somewhere because these interventions are going to be working because of who is in the room. And I think as long as we keep the main recipients of these designs in the room and at the helm of the design, we're going to see the ability to create more of this, and we're going to see, better health outcomes.
Thank you for that response, Dr. Davidson Monday. It makes me think about something that Dr. Willis mentioned earlier. And here at P4HE, and I hope in the public health field in general, we are really trying to move towards asset-based framing rather than deficit-based framing. And part of that includes Black joy. And so some of the topics that you all are addressing can be very heavy. And so I wanted to know how you see the role of Black joy in either your work or for yourself in doing the work for the community. Where do you see that? We can start with Dr. Willis. What do you think?
Yeah, so I mean, I think joy is an integral part of all of those different kind of contexts for myself as a researcher, for the work, and for the community. I see joy as essential as not only an energy source, but also as a way to restore ourselves and as a way to heal, from injustices. And so when I think about joy in the research process, thinking about like what does it mean for me to be present in the moment when we're co-creating apps, for example, and use and really trying to be present and see the joy and kind of giving that power and agency to the Black youth that I co-create with, and really, seeing them kind of take these things and kind of run with it and have fun with it. Those are the kind of things that give me joy, and it also gives them joy. And I think it's this bi-directional relationship. So if we can both kind of experience joy in those research moments, we have impact in the moment way before anything is written up for publication. And that kind of sparks so many different ideas and new tethers that can lead to, so many different outcomes that we don't even think about when we kind of approach a research design. But it also means that I have to be mindful as a researcher, especially, one who focuses on race and racism, to find that joy in my everyday life and in my community, because, I have to fill my own cup because that's going to impact how I show up and show up to the work. And so a part of joy is also being not necessarily selfish, but mindful of kind of how you're showing up and doing what you need in order to show up, not only for your research participants, but for the community that you're trying to serve.
Dr. Davidson Monday, do you want to go next?
Sure. So I'll start with a personal. I'm a mom of 3, and they give me a lot of joy. And I have 2 teenagers and an 8-year-old, 2 teenage boys and an 8-year-old girl. And so a lot of my work is because of my lived experience and wanting to frame Black parents as strong and resilient and full of wisdom and love. Right? I think a lot of framing around Black parenting is very deficit, and that's intentional. Right? It comes out of this sort of racist trope that we are not good parents because our kids are more at risk for this and for this and for that. But when you speak to parents and you hear how much they are really pushing through very challenging experiences to get their children on the other side, right? To keep their children healthy, to keep their children alive. Interestingly enough, in these engagements, whether it's focus groups or interviews, there's a lot of joy that comes out of these experiences. And because, I think we think of parenting as a privilege and a purpose, and sometimes we're not written about that way. I'm saying we now, like I'm taking myself out as a scientist who's like, putting the objectivity hat on the side. But I just get a lot of joy out of engaging with people that join our studies and our programs, because they're reaffirming to me that as difficult as our topics are, right, that it is important for us to have difficult conversations in order to protect the joy that we're all fighting to have and we're all trying to put in our homes. And so I think of joy as an extension of, safety, right? We want our children safe. We want our children healthy. And how we're doing that in our work, I think will lead to sustaining the joy that I get to see as a sexual assault researcher, as a sexual violence researcher, I get to actually see that a lot. As much as we are listening to stories that are traumatic and engaging with folks who have gone through some of the most painful experiences, to see them pushing through and giving us advice on how to support other people in similar positions. It may sound trite to define to shape that as joy, but honestly, there's a lot of hope involved in our work. So I'm grateful to be able to do it.
Thank you. Dr. Lewis, what are you thinking?
Yeah. So I think it's a great question. And three things kind of come to mind, particularly thinking about joy and centering joy as an unspoken kind of aspect of my research. So, for example, thinking about current research, looking at suicide and suicidal ideation. And throughout the interview process, one of the kind of undercurrents is to talk about joy. So, for example, the question is, how do we integrate specifically Black joy into suicide prevention interventions for Black emerging adults? And when I say usually, I am speechless at the ways in which the youth are just conceptualizing not only the concept of suicide, suicidal ideation, but Black joy and what that looks like in a current society where anti-Black racism is a norm. It's just, it not only brings me joy as a researcher, it brings me joy just to see and to understand on a firsthand basis that the younger generation, they got it. They really do. And so that brings me joy. I think about the joy in interacting with them and going back to what my colleague says as an elder millennial, they are quick with it. And it just brings me joy in the way, even in sometimes in the interview process, they'll push back on questions, they'll push back on thoughts or the ways things may be conceptualized. And that type of just ability to say, no, I am the writer of this. I do understand this. I am the whatever kind of term you want to use. This is my reality. And this is how I am going to narrate that reality, regardless of what you as a researcher may think. That brings me joy in that pushback, because understanding as the society continues to grow in whatever direction it is, we are going to have to build community and build stamina in ways that we have never imagined. And so the last part of joy is just the service, that ability to transfer, take down, or even release some of that power as I am going into communities, yes, that I do look like, but understanding I am not a part of. And how do I use that service as a way, which is joyful to me, to say, I am here to help, I am here to serve, I am here to listen. Let me know how to be better and how to do better. And so those are the ways that bring me joy.
That was beautiful. I really appreciate that, and I appreciate you all engaging not in this conversation, but this concept of Black joy in the work that we're doing. But it literally just occurred to me, which this is why you have dialogue, because it is generative. And I want to ask, that question, what do you see in the future? But like, where do you see Black people in tech and health? So I'll add them together. Black people plus tech plus health in the future. What do you see? What do you want to see? Where do you want us to go?
I can start. I want to see Black people at the helm of designing and developing these products. It's not just representation. I think we have ingenuity that needs support, and we need the resources, and because the agency is there, but the resources need to be redistributed and put in the hands of those who are impacted by whatever's being developed. So hopefully in 5 years we're seeing more of that, and at the same side of that is holding these things accountable to the side effects of such a harsh development on the environment, right? So like somehow we're keeping ourselves accountable to the use of of these new technologies so that we are not harming the very communities. Like we're putting data centers and we're putting this, like we're harming the same communities that we already know are disenfranchised and marginalized. So in 5 years, I want to see higher accountability on that. And I think there's, in terms of policymakers, we're seeing a lot of important policymakers. Well, we hope that they will be in position to hold the powers that be accountable. So that's one, is that we're in the room, we're designing it, and we're holding the space accountable. And I think also in the future, to coming out of that is belongingness that addresses the harm of structural injustice and structural racism. And so, if possible, or talking about Afrofuturism, if possible, can these spaces reduce inequity somehow in all the forms, right? And again, I think that still goes back to who's designing it and who's holding it accountable. But 5 years is not a lot of time, and I think, right? But if we can see pressure to do those things, coming from a human rights framework, coming from a justice framework, coming from a Black joy framework, right? Can we use those frameworks to keep ourselves and those who are in the power to develop these tools accountable, so that the future of our communities are healthier and not harmed?
Yep. I can follow up on that because I have a lot of similar thoughts. I first and foremost would want to see Black people, Black communities at the center of developing and implementing these technologies. And one of the things that, I really would hope to see in 5 years is more pathways for us to produce these Black Afrofuturist kind of developers that don't include having to go get a PhD or kind of go get an advanced degree in technology. Because in a lot of ways, like we talked about, some of these solutions are already in the community. So right now at UMD, I started an internship program for high school Black students in the area where we're teaching them how to both learn mental health skills, but also how to create digital solutions to mental health problems in their communities. And I think this is one way we can, as a field, and in thinking about health equity, we can think about how can we empower youth and communities to have this knowledge, to develop these things without some of the traditional pathways that we've had to take to develop these types of technologies. And I also hope that these technologies in 5 years will, have reduced stigma around talking about mental health services and seeking mental health care. And in a lot of my work, that stigma is still one of the biggest barriers for Black communities, especially between generations. So I'm hoping that these technologies can equip youth with language to talk to their parents about mental health problems and vice versa. And I think this intergenerational communication is what's going to be really important in kind of continuing to tackle some of these inequities that we see in mental health care. And then hopefully, I hope these technologies can, again, kind of combat that kind of isolationist view we have when it comes to technology and things that are online, and think about how these technologies can actually create community and create a sense of belonging, like Dr. Davidson Monday said, so that we can have that sense of Black joy, not only online or via technology, but also in our offline everyday life.
Right. And I think about me. So, for example, what I would want to see is representation, but representation with an asterisk mark. I want us as a community and also as a society, if we're thinking about that, I want us to think beyond the binary. I would be very explicit about that. Beyond the binary and across the spectrum of ability, disability, and sexuality when we are talking about particularly Black folks creating things, understand that it's not a monolith. And when we truly interrogate the systems that we hold within ourselves to really understand and prioritize or even platform perspectives that don't look like our own, I feel like that is one of the ways in which you can really push it forward. And just even also in like my research area, I want us to, or look forward to in the next 5 years, really having deeper conversations about whiteness and how that impacts how we even think about mental health. And I owe all due respect to the emerging adults that I work with that push me to even think about it, or show me that as a researcher, I can be comfortable to talk about these things. And I know where we are, particularly in kind of like anti-DEI rhetoric, but this is something that we can no longer put a band-aid on or just continue to whisper as we are thinking about health disparities, especially as we think about the growth of AI and how it's going to continue to replicate and manifest new forms of inequality.
Whew, you said a mouthful there. You all have said so much, and I've learned so much, and I've thought about a lot. And like I said, this is the start of a dialogue, conversation. I'll say a movement in public health or health related fields, extending what we're thinking about and talking about when we're thinking about health equity. So I really appreciate all three of you all for being here. Thank you so much.
Thank you.
Thank you.
Thank you.
Listeners, we hope you found this to be engaging and that you join us for our next episode. If you have any comments, please share them on our podcast page at Spreaker.com or on our social media channels. Thanks for listening.
Thank you for joining us for this episode of Partners for Advancing Health Equity. Be sure to visit our website and become a member of our collaborative at partnersforhealthequity.org. That's partners, the number 4, healthequity.org. Follow us on your favorite social media platforms and be sure to subscribe wherever you enjoy your podcasts. Partners for Advancing Health Equity is led by Tulane University Celia Scott Weatherhead School of Public Health and Tropical Medicine, is part of the Tulane Health Equity Institute, and is supported by a grant from the Robert Wood Johnson Foundation. Until next time.